Good morning to everybody. My name is Paolo Strati. I'm currently an assistant professor in the Department of Lymphoma and Myeloma, but I also have a joint appointment in the Department of Translational Molecular Pathology at MD Anderson Cancer Center in Houston, Texas. And I'm very glad today to have the opportunity to be a speaker for this ASCO session titled Coming to the US for Residency or Fellowship. I will try over the next 10 minutes to summarize my experience as an international medical graduate who had a quite crooked adventure actually to get to the United States. And I will also try to go through some specific questions that ASCO would like for me to address for you. So briefly, I'm originally from Italy, and I completed my medical school in Italy in 2008 at the University San Raffaele, Milan. And then I actually stayed in my country for postgraduate training. I did there my residency and fellowship. And at the end of my postgraduate training, I had the opportunity to move to the United States, initially for what was supposed to be a one-year subspecialty clinical training in leukemia lymphoma at MD Anderson. But then, as frequently happens, it became 2 years, and then I briefly left for a few months. And I went to the UK. I worked at the Breast Cancer Institute with Dr. Greben in London. But then eventually I decided to come back. And as you all know, the only way to come back is to redo all your training. So I went back to residency. I was actually lucky enough to match into the internal medicine residency at the Mayo Clinic in Rochester, Minnesota. And then I went back to fellowship, and I also was lucky enough to match at the Hematology Oncology Fellowship at MD Anderson in Houston, Texas. But how did I get there? So I'm gonna go back to the beginning. So as I mentioned before, I graduated in Italy, and I completed there my postgraduate training. Now you have to know that in Italy, we don't really have a separation between residency and fellowship. We just do a 5-year specialty. So one way that you can consider to move to the United States directly into clinical training is if you already had done your postgraduate training in your country. So as you know, many people will try to move to the United States immediately after medical school. And in my experience, as I hear from other people, one way to do that is to do some research in the United States or to accept to match into a low-tier residency program. But usually, again, if you have already done some postgraduate training in your country, at least 3 years, that can be acknowledged as 3 years of American residency, some subspecialty clinical programs will accept you. Many institutions have some specialty programs. So again, in my case, was the first year of leukemia fellowship and the second year a mixed leukemia lymphoma fellowship. They do accept, people who haven't done any training in the United States, as long as you had at least 3 years of postgraduate training, clinical training in your country. So in my experience, that was very helpful for multiple reasons. First of all, it gave me the opportunity to do immediately clinical training in the United States. I really had no other experience in the US until I started my leukemia fellowship. And so that was amazing. Because as you know, when subsequently you apply for residency, having clinical training in the United States is extremely helpful. In this case, was clinical training in a very high-tier institution such as MD Anderson. And then the other reason why it was very helpful is that by doing subspecialty training, I was able over the course of 2 years to publish multiple papers in high-impact journals and also have presentations and international conferences and get some awards. And that way, when I applied for residency, and maybe more than for residency, for fellowship, that was extremely helpful because, of course, it gave me some credit. So that's something that I suggest. Sometimes you can consider, instead of just leaving your country immediately after medical school, to stay there and do some postgraduate training. Then I have to say that in my experience, having publications and presentations was probably more helpful for fellowship application as opposed to residency application. What really mattered for residency application, at least from my experience, is having the US clinical training and also not having any gap in your training. As you can imagine, when I applied for residency, I was older. I was in my early 30s. And so there was some there's always some concern if you come from another country that you may have been doing a lot of research and be out of clinical training for a very long time. It wasn't my case, and that was very helpful. So being able to demonstrate during my interview that I never interrupted my clinical training, and actually had a lot of clinical training between Italian postgraduate training and US clinical fellowship, that definitely helped me. Whereas when I applied for fellowship, I felt like the clinical training that I had before didn't matter that much, but it mattered more my focus, expertise in a specific area, in that case, CLL lymphoma. So those are two things that you need to work on separately because they have both a lot of importance for different applications, residency and fellowship. Now, as I have less than 5 minutes left, I'm going to go through the specific questions that ASCO Council would like for me to address during this brief presentation. So first of all, well, I already did a general overview of my experience from my application to acceptance. So my path to USMLE, that's something that I also really like to share. So as I mentioned, I came to the US after my Italian residency and fellowship. So I actually had to study for my USMLE while I was Italian internal medicine resident. So as you can imagine, my schedule was very busy. But despite that, and this is not to brag about myself, but just to give hope to everybody, because I feel like there's a lot of psychological violence that people tend to do when it comes to giving suggestion about how to take USMLE exams. I was able to take all my exams within, I would say, less than 6 months with very high scores. So my secret is that what I did, instead of spending a lot of time reading USMLE books, because you never be ready enough just based on books to go ahead and take your exam. I tried to optimize my time. Again, I didn't have a lot of time because I was a resident in Italy and I was at work all the time. I was literally studying just night or over the weekends. So I just used websites that you have to pay for, where you have the simulations of the USMLE exams. And I kept taking those over and over until my score was high enough that I felt comfortable to take those. So that's my suggestion number one. You have limited time, try to optimize it. And again, probably just, at least for me, was very helpful to use the web-based simulations as opposed to reading books. Other questions are how to get rotation in the US and how to navigate research in the US. Again, I don't have really experience to that regard. I haven't done basic research in the US and I haven't done any rotation, so I can't really comment in regard to that question. Virtual networking tips and tricks. So my only suggestion is to try to work really hard in your country and trying to be liked by your mentor. And that is going to help you with virtual networking. So in my case, what helped me to get into the first fellowship, the Leukemia Lymphoma Fellowship at MD Anderson, that was my first dive into the US system, was having my mentor advocating for me. But the way my mentor advocated for me was through my hard work. So I'm sure you already do that, but work really hard and try to be liked by the people you work for. And don't be shy to ask for help. So I told him bluntly that I really wanted to come to the US and do my research and clinical training here. And that was very helpful. And the same thing applies to how to obtain letters of recommendation. You have to be liked by the people you work with. And eventually it will be very easy to obtain letters of recommendation. I know this may sound as a disappointing suggestion, but it's very true. You will get letters if you work really hard and people acknowledge that you are somebody they are comfortable writing letters for. My final suggestion with the last minute that we have is that you will hear from multiple people, multiple ways to make it in the American system. You heard my story that may be pretty unique, and you may hear 100 different stories. But what I would like for you to believe is that you can write your own story. I know this can sound very rhetorical, and of course it's helpful to listen to other people's stories, but never believe that that's the only way to make it. You are free to make it your own way. So, in 5-10 years from now, you should be here taping yourself and telling your very unique story, and I'm sure you'll make it. So good luck.